remember these.
What are you trying to say?
Mom?
Yes.
Hey, what do you
Ciao.
say, Bob?
Yeah.
You're in trouble.
Yep.
So I mean, things are not like what they were like 2 years ago. They are like really concerning. I have to right now, Mr. Platt, you know, he's needing the special medicine, which is the Levophed. Hi, how are you?
Very good, and yourself?
Very good. Please. Do we need a check? You know what? Please
No,
have a seat.
I'm fine, I'm fine.
No. Have a seat. I'll get a new chair.
Oh, well, thank you, sir.
Let's get that rolling one out there.
I know he's an optimist and he's a fighter, you know, and you know, he doesn't give up. The last 2 years ago when we found that like the extent of the cancer, we were worried that, you know, even at that time, like maybe palliative care and hospice would be the best route if you don't treat it, because it was already in the bones and it was you know, situation wasn't looking the best at that time. So at this point in time, it seems like the cancer, you know, just, because the thing is that, you know, I just like to know what's going on. Can you hear me? Hi. How are you? He's warm.
Check what's the temperature.
Yeah.
She just checked them.
Yeah,
Seems warm to me.
Probably, earlier it was like 98.2. Sounds good. Being warm?
Yeah,
He likes to be warm.
Yeah, his eyes are open.
Yeah, he's been. Let me get out of the way.
Yes, it's improved.
Better today. Yeah.
Yeah, no,
definitely.
I've made a few changes. I've started diuresing him because he was having trouble breathing, he has fluid in the lungs. And then his kidney function is better because we were giving him a lot of fluids, his pressure was low too. But with all that fluid resuscitation, you know, he got fluid overloaded, what we call, like too much fluid. And that was causing him to breathe really hard and a lot of wheezing this morning when I saw him in the chair this morning, and he was alert but not much responsive. So I went up on his this Levophed, which is a medicine to keep his blood pressure up so that, you know, he's more alert and to get better brain perfusion. I started him on stress dose steroids because so his body can fight or can mount a stress response, because right now he's in septic shock, and there's an element of you know, possible cardiogenic shock because his heart enzymes. So he's got multi-organ you know, failure in terms of.
I'm sorry, could you please repeat that?
Oh,
about
sure.
The heart, because this.
So he's in shock.
Okay.
So there are 2-3 things that are going on right now. Number one is, you know, the confusion because of the high calcium levels. The high calcium levels are from the cancer eating the bones, what we call increased osteoclastic activity, which is very common with prostate cancer, and can raise, and when it eats the bone, the calcium level in the blood goes up. And then when the bone activity is increased and the body tries to counteract it by increasing the bone cells that form the bone, and because of which the enzyme, which is called alkaline phosphatase, goes up. It tries to counteract. The body tries to defend, but at the same time the cancer tries to eat up the bones. And because of which, you know, he's got this terrible back pain. And that is one thing. You know, the calcium level, we've done well with that. You know, it's normalized. So his confusion is, he's more alert today and other thing that's affecting his mind is the low pressure and the septic shock or the infection, which is because of the pneumonia. He's got multifocal pneumonia on the x-ray, but it is better than it was like yesterday. But at the same time, the x-ray showed that he's got fluid in both lungs, what we call pleural effusion. And that can happen because when we give a lot of fluids to get the pressure up and to support the body, that can happen very commonly. The other thing is that to treat the shock, you give antibiotics. So he's got two types of shock right now. One is because of an infection, which is pneumonia. The second thing is his heart also getting affected, because of which the heart enzymes are going up, and now they're trending down.
Is that because of the steroids?
No, that's because of the shock. Because when the perfusion to the organs is affected, the multi-organ, what we call, when we go in shock, the body does not get enough fuel to the organs. So the heart is not getting enough fuel, because of which the heart gets injured. Because of which the troponins, which are the heart enzymes, which are a marker that tells you, like you, on your car, like you have your low pressure sensor. So the heart has a sensor, which is the troponins. So that sensor turns on, like the troponins go up, because that means like the heart is getting injured because of the low pressure. To counteract that, we're giving him this special medicine, the Levophed, to improve the flow, the blood flow to the heart and the other organs. The other organ that is getting affected with perfusion is the kidneys, because of which his kidney function was bad when he came in, because he was so dehydrated and he was in shock, because of which his kidneys were not getting enough perfusion. So that medicine also helps the kidneys. And the third organ that is getting affected by the shock is the brain, which is, other than the calcium affecting the brain, it is the shock that affects his brain as well. Now, the fourth issue, which is like a big issue, and is basically the prostate cancer, which is, we know, is metastatic at stage 4. Now, I was looking at the old reports from the oncologists with radiation. It appears they said that they showed some, like reduction in size of the nodules and other parts of the, the cancer, but at the same time, clinically, that is affecting him, his overall organ, like the shock, and then cancer on top of it. That's affecting his whole body as a whole.
What changed since yesterday? Excuse me, because we got a good report that everything was like homeostasis. It was, the calcium was clearing out, and things were normalizing. And the only thing that was being hindered was the speaking and that.
And that is true. So that is, he came to the hospital because of confusion and being minimally responsive. But I'm telling you, like, what's going on right now. What is going on as a whole in his body. Having said that, I'm not saying that we're not trying. He's definitely improved today, because we've been making those efforts to tackle those things. Target his breathing, improve his breathing by diuresing him, improving his breathing by, basically improving perfusion to the organs by going up on the titration of the Levophed. And that's why he's like more alert and awake and responsive. So I am addressing this very aggressively. But at the same time, I want to address the long-term goals. Short-term, yes, we're going to try to get him better to the best of our abilities and leave the rest to God. Because I know him, because I know we had that discussion, and then he said, no, I want to give myself a chance. From the American Cancer Center in Chicago, I think you had contacts, and then we did that, and then, he was singing at that time, and that was a different Mr. Clapp. It was, but this time, eventually the disease is taking its toll on his body. But we're going to try to help him. I'm not saying that he's not improving. Yes, he's improving, but at the same time, long-term thinking, like, what's to come. God knows best what's going to happen tomorrow. But my purpose of getting you here is to let everybody know that, he is, yes, he's sick, and we're trying to, improve him, try to get him off this medicine. That's why I started him on stress hydrocortisone on the steroids to help his body fight this, shock and maintain pressure so he can hold his blood pressure on his own. And so I can start him to a point where he can take pills. And, so we can maintain his pressures not through the IV medicine, but through, pills. And
What
then
kind of pills would that be?
those are called Midodrine. So that's also a vasopressor sort of thing that helps with the blood pressure, keeps the blood pressure up. So he's got better perfusion until we can get him off those pills, and the infection improves, and the heart gets stronger, and those things.
Okay.
His years of exercise and him being active has helped him, because if it was somebody else, they would have not been able to, last for 2 years with the disease, the extent of the disease that he had 2 years ago. This is an extraordinary situation. But I'm just saying that,
Yeah.
exactly, absolutely. There's, God helps. And like I said, we still trust in God. At the same time, we have, nobody's gonna be here in this world forever. We have to transition one point or the other. And all of us know that. And only God knows, like, when it's time. So, but at the same time, what I want to say is that in the event, during this journey in this world, God forbid, if his heart was to stop pumping, or he cannot breathe on his own, what we would like to do. So, Mr. Cladd, I know this is not the best time, I know you're recovering. And we are gonna continue to try to make you feel better, okay? And I'm trying very, very aggressively and very, to get you better. Because, we all care about you, and we want you to have the best quality of life. And get you to the point where you are strong and you can go home. But, at the same time, we have to think about next steps. That, God forbid, if there was a medical emergency, and your heart was to stop pumping, or you cannot breathe on your own, would you like us to resuscitate you by doing chest compressions, or put you on a ventilator to keep you alive? Or just let you go in peace?
I'm going to let you. I'm going to ask you. I'm going to heal. I'm going to let out
Yeah, so,
there.
absolutely. So, that is fine, the eventual goal is to get him better and get him home. And that is what I'll be trying throughout. At the same time, I have to be realistic, and I have to be honest with you and tell you that he is very sick. And of course, God, he holds the final, control, and he has the final say. I am only human, I only have limited knowledge, but in my limited knowledge, I know that he's very sick, his cancer is very advanced. He's right now in septic shock and cardiogenic shock. So we're trying to resuscitate him, and we'll try to resuscitate him. But at the same time, I know he's a full code right now, which means that, God forbid, if his heart was to stop pumping, he stops breathing, we'll call it cold blue, we'll try to do chest compressions, we'll try to put him on a ventilator to bring him back.
Do you want that, Danny? Do you wanna go on the ventilator?
No,
No, I don't think he
No.
wants,
no, Debbie, no.
So we'll try to make him comfortable at that point in time,
Please, I'm in the home hall.
Yeah. But having said that, I'm not gonna stop. I'm not gonna hold anything back. I'm going to try my utmost to get him better to the point where we can get him off these medicines and get him stronger and get him home. But, like I said, God holds the final, he has the final say, and we leave it to him. But I'm trying very hard right now. I've started steroids, trying to get him off get his brain perfusion. So we're targeting a higher goal. You see that 75 is the average. Normally with the pressors, we would target a MAP, or what we call the mean arterial pressure of 65, which is great for the other organs. But to get better perfusion to the brain, you have to target a higher MAP, which is more than 75. So that's what we're targeting right now, to get him better perfusion to the brain, so he's more alert. And my goal is to eventually try to see that when he feels well enough, so he can start eating and start him on a diet. And I have no doubt, knowing him and his resolve, that I have faith in God and I have faith in him, that he's a fighter and he's going to try his best
Yes.
as a team member, and I'm going to try my best as a team member. So we'll work together as a team to try to get him better. But on the way, if God has other plans, so we'll let God decide. Okay? So that's what I wanted you guys to be aware of. Okay? Because I want you guys to be aware that, I don't want you guys to say, hey, we were saying the calcium is getting better. Yes, that's one element. But looking at him as, I have to look at him as a total, as a whole.
Sure.
Looking at other systems, because I cannot say, hey, one thing's done, so I've done my job. That's great. Yes, that's true. Calcium is normalized. But he's not where we want him to be right now. He's still requiring, the medicines to help him with his pressure. So we'll continue to work. Our work is not done yet. We'll continue to work. I'll continue to update you guys, keep you guys in the loop till my friend feels better.
His blood pressure usually, I'm sorry, go ahead.
Oh, here's the thing, on
Go ahead.
His blood pressure is always running lower, so would that affect, the stats in any way that, cause I know average you said 75?
No, this is because for his brain perfusion right now with this medication. Till he's able to come out of this shock state and trying to support his heart with getting rid of that extra fluid. So I'm giving him Lasix because I know if I didn't do that, his pressure will drop with the Lasix, because when he loses volume, the blood pressure will drop too. But that'll help him with his breathing. So his breathing is better, because when I saw him this morning, he was in the chair very uncomfortable, and he was breathing very fast and hard, and had audible wheezing. That's when we kind of decided to do the X-ray, look at the heart, review things.
So, do you use infrared here at all? Is there anything for the chest? Like, could they do anything infrared to get rid of the pneumonia in the chest?
Technically pneumonia has got 4 stages. It takes its time. You treat with antibiotics to kind of get rid of the, hit the bacteria hard, identify the bacteria, and otherwise give medication that would address the most common bugs and would kill those bacteria. And then the body, goes through different stages of healing. And the whole process takes roughly from 4 to 6 weeks for it to resolve. But we give the antibiotics for initial 7 to 10 days. In his case, we might treat him for a bit longer, maybe 7 to 10 days. Normally we would do for 5 because he's in shock. So, we might need to take a longer course of treatment. Maybe, choose that. And then go on from there. And then it will resolve, the body resolve on its own. And then his breathing will get better. But the good thing is he's not needing a lot of oxygen. He's still 99%, just 1 liter, so which is not a lot. And that too is not only because of the pneumonia, also because of the fluid in the lungs. Now, there's now a second way we can get the fluid off the lungs, which is, let's suppose if his blood pressure is more labile. We see that anytime we do diuresis, it puts pressure on the kidneys too much, or drops his pressure. Then what I can do is I can probably we can take manually fluid out through a catheter, put it inside the lungs, or the thoracic cavity, not inside the lungs, but in the thoracic cavity or the chest cavity, to get that fluid off. So that way also the lungs expand and the breathing gets better. But by the grace of God, I mean, I think things are settling down gradually. So, you know, I'm not gonna push it, I'm gonna do it like if we need it. But right now, we're taking small steps, not tweaking a lot. You know, doing fine tuning, but not doing too much. So his body can recoup and recover.
I have a question. Is there any way, like, if that was problematic and it's not moving, and that he could do any kind of like postural drainage techniques on it or anything like that?
Yes, definitely. I mean, like, there are different things that you can do, what we call bronchopulmonary hygiene, or like toileting. So there's like vibration vest we can do, there's like cupping techniques, there are different types of devices that we can use to get that. And we also can give him medications to break down, you know, like thick secretions and that help him to expel those out. And the last course is maybe like bronchoscopy if the need be. That, you know, this is going with the camera, the special camera, and the lung doctor goes through and, you know, goes into the lungs and all the passages, and then they can try to suction all the secretions and see if, you know, there's anything that needs to be done.
So he's definitely gotta go under for that one, huh? Right?
Yeah, you need to have some sedation. But at this point in time, you know, we're not there yet, he doesn't need it. He's doing good with his oxygenation. The biggest thing is his blood pressure and meditation, but he's come a long way since morning. I can see my friend now, you know, he's got his eyes open.
Is his liver and kidneys still improving?
Kidneys better. The alkaline phosphates is going up, but I can see that, you know, it's, because the PSA went up, that means like there's a recurrence of the cancer. We'll talk to the cancer doctor more, see what we can do about that. But for now, first things first, we need to stabilize him before we can tackle that. The good thing about prostate cancer is that yes, it spreads, but at the same time, it is a slow process. And most men would, you know, or people would, you know, succumb to other causes like the heart or like other organ before the prostate cancer. And sometimes in some patients, it can also be very aggressive. So everybody's different. But like I said, he's exceptional. I'm not just saying it because, you know, he's a family member. I'm just saying that he is exceptional because he's led a healthy life, being like extraordinarily strong, and so I mean, I would normally not see that. But just because of his healthy lifestyle, his body's like other organs are able to work with what we're doing right now. But
Is
sorry,
any
go ahead.
stem cell, anything could any in that way help?
I mean, right now, with the issues that we are handling right now, stem cells probably don't have a role to play in terms of supporting a circulatory system. But, you know, right now we'll have to work with medication. And right now his heart is strong enough to work with that. So he doesn't need any like extraordinary measures at this point in time. But I just wanted to let you guys know that, you know, what are the problems at hand that we are dealing with. So you guys are not like, you know, okay, what's going on? My uncle was okay. What did Dr. A do? So I just want to make sure that you guys are aware, you know, because I know I saw him 2 years ago, and you know, this is a different, you know, condition. He wasn't as sick as like this time. At that time too, we were thinking, oh, he's got pneumonia, and then he's like, I got this back pain, and then I was like, why does he have this back pain? And I saw his enzyme being up, and then we started working up, and we found that, oh, this is what's going on. And he was walking at that time, and then he was just like losing weight. That was the biggest thing, and I think he fell or something.
Yeah.
But then he gained weight.
Yes.
He went back up.
Yes, and you know, I like I said, I want to give him the best possible chance, and that's what I'm trying to do. And we're going to continue to work and fight. But at the same time, I want you guys to be aware of what's going on. So when you look at the profile, you're like, oh, the creatinine is high, the troponin is high. What does this mean? The uric acid is high. What does this mean? I mean, there are many things that are, you know, that can. The D dimer is high, which means like could be a clot in the legs or the lungs. But then again, we cannot give him a blood thinner. Why? Because his INR is high, the blood is already thin. You don't want him to have internal bleeding or bleed anywhere. So it's like a tricky situation.
You're balancing it.
Correct. So I talked to the blood doctor today. I was like, okay, the INR is still high. What should we do? The fibrinogen is high. I mean, we don't want him to bleed from any other sites. And then we're like, okay, let's give him vitamin K today because the INR is high, and then see how things are. So we give him vitamin K today. We started on steroids. Went up on the target, so I wanted to see if he wakes up, and he's responding. So which is great. I'm pretty happy by the grace of God. That so far, like what things we've changed, he's responding. But at the same time, you know, I hope for the best, but I want to be prepared for everything. And I want you guys to know that, okay, you know what, this is the situation, this is the range, but we hope and pray to God that he you know, we have the best outcome.
Right. Any little area of resistance to the body is gonna be a big deal right now because he's already under so much stress.
Correct.
Is there any one of those that you mentioned when my son asked about the positioning or the cupping or
Correct.
whatever you said?
Correct.
Is there any one of those that we could do
Sure.
right away?
For sure. I'll just order that, and I'll talk to the respiratory therapist.
Okay.
And you know, even today we're trying to move him from the bed to the chair and get him moving, his body moving. So the body gets cues, and he's a guy who's very active.
Mm-hmm.
So I mean, once you give his body cues, so you know the body and things set in motion. We're already doing the changes in position, and once he's sitting in the chair, we'll do those bronchopulmonary over the vest. You know, but at the same time, because he's got those like with the bones, I don't want like any kind of the vibration.
So
I don't want to have a pathological fracture or something. So we'll see even with the cupping and some other like the PEP. You know, there's positive airway pressure technique, like in which there's a device we use that you know they can use to help him. But like I said, his oxygenation is great. It's 100%. So that's not. So we'll kind of back off. In fact.
Is that amazing with
It is.
what he has going on right now
Yes.
in the lungs?
Yes, I mean like I said, his lungs with the fluids. Since I give him Lasix in the morning and now Lasix right now, he got a second dose. So this will get the fluid off, and this will improve. And the pneumonia is there, but like I said, since he's got healthy lungs overall, like other than the cancer and the pneumonia, so you know, so that is why he's able to have you know such a good outcome.
So how long should it take for an intracellular effect with the fluids, since you've been given the Lasix?
I'm hoping that, you know, I'll repeat the next tomorrow morning and see how he's doing. But I can already tell, you know, because he's breathing easy, respiratory rate has come down. And, you know, he was like in the 40s and he was breathing really fast and hard. So that's a good sign when it comes down. I want him to be in the 20s.
It
So,
was earlier.
yeah, so once he relaxes, you know, because when he hears my voice and he's listening, trying to focus, trying to be alert that everybody's there, trying to be present for everyone, so he's not able to relax. But you know, once I'll let him relax, let him get some sleep and rest, and then we'll kind of go on from there. But I think the goal is to keep him in the 20s. I don't want him to be breathing too hard, like in the 30s or 40s, because that puts pressure and then stresses your system. At the same time, he seemed warm to me, but I think like after I held his hand in a little bit, I think that he seemed that he's probably got a normal temperature.
Hyperbaric machine wouldn't
Correct.
be a bad thing either, would it, right now?
So,
or-
so it has got certain indications, but right now, like I said, he is not at the stage in which we would need that. But yes, you're right. That is used. That has got curative properties in a lot of diseases, in a lot of pathologies in which it promotes healthy healing, like proliferation of vessels and all that. So you're absolutely correct. But in his case, his issue is not that. but I'm hoping that, you know, in the next 24 to 48 hours, if we can gradually try to wean him down on the oxygen, keep his calcium levels low, and get him more alert. And we'll just evaluate, like I said, hour to hour, minute to minute, and day to day his progress, and then go on from there. Have therapy work with him, make him sit, move around. Like your son mentioned, you know, we'll try to have work with the respiratory therapist, work gently with him, and improve the circulation. And like he's also moving his arm, like, you know, legs and feet to keep his circulation going. So I think, like I said, I'm an optimist. At the same time, you know, I have to be a realist too. So I'm not gonna hold anything back. I'm gonna try very, very aggressively. I'm gonna give him the best possible chance. If I feel that he will benefit for something that I don't have here, I'll get him to a place or point you guys or direct you guys to in the direction in what he needs.
Appreciate
So I'm not gonna hold off anything. But at the same time, I am glad that we talked and he was able to, you know, express his wishes that, hey, if it's my time, it's my time, you know. He's had a full life. He's helped so many people, and he's loved by so many people. And so many people are praying for him, so many people are here for him. And I remember him in Magic from 2 years. I recall like things because he's had such a lasting impression. And you know, he makes you feel so welcomed. So, and you know, and that's an amazing quality that he has.
Big heart.
He's got a big heart, and a wonderful, wonderful human being.
Yes.
Yes. Very nice.
So I will continue to try. I'll be doing my utmost as a human being, and you know, every day I come in, I pray that God guides me to make good decisions for every patient, and I
That's
just
awesome.
hope and pray that, you know, God continues to guide me in the right direction, and will make good decisions and the right decisions,
Awesome.
and that the child are going to be beneficial for him. And then here at the same time, keep you guys, you know, aware, because I want you guys to be aware of what's going on.
So
Yes.
the nutrition factor, I mean, cause right now he's been basically malnourished, so you are giving him
Absolutely,
more
absolutely.
nourishment and.
That's a wonderful point that you brought up. So I'm going to talk to the dietitian. See, like, you know, first of all, first things first. My ultimate goal is for him to eat on his own, naturally. You know, get him like protein supplements, Ensure, and protein shakes, and give vitamins. Because the other things like the TPN, and then this is like through the peripheral IV, through the PICC line, the central line, that increases the risk of infections. You know, because it has sometimes sugar in it, and sometimes some of those things can increase the risk of line infection and bloodborne infection. We will do that if we absolutely need it, yes. We want him to be stronger, so if he needs it, he needs it. The other thing is like doing tube feeds. Sometimes they do
I'm sorry,
tube feeds.
Oh.
Through the NG tube or the OG tube, like they pass the tube through the nose, like a nasogastric tube.
Oh, yeah.
It goes through the nose into the, but that's painful.
Yeah,
right? That's,
we
you know,
wanna try to avoid.
But I mean, but those are the different
Yeah.
ways you can do. The third thing is they do a tube into the stomach, which is the PEG tube. But, you know, I'm hoping and praying that he can eat on his own.
Yeah.
Because he doesn't have issues with swallowing, he's been so far doing great.
Yeah.
He was able to take some medications. So I'm hoping, that, you know, he's able to eat on his own.
Is there anything besides Ensure and Boost, that is not as high in sugar? Cause they're
Of course.
loaded.
They're different formulas, so I'll have the dietitian, they're like the experts. So Katie or, I think it's Tara or Tara? Tara. So she's like, we have 2 dietitians,
Okay.
and whoever's gonna be here, we'll put a consult for them. And then we have multidisciplinary rounds at 9:30 every day. We'll tell them that, you know, my friend is here at 3:30 and we need to evaluate his caloric intake, see what we can do for him. And the best thing is, you know, what I'll be praying for and I'll be hoping is that he's eating on his own and we can supplement it. You know, but if his intake or the calorie requirements are not being met, then we'll see what we need to do.
Thank
So
you.
we'll be right along with you then.
Absolutely, absolutely, you know, that's what we can do. We can change destiny by praying to God. And like I said, that 2 years ago, even then at that point in time, it would be a very, very critical situation. But it's amazing. When I saw his picture, I was like, oh, I know him. I got very excited. I was like, oh, okay, you know, because today was my first day back, and I saw him. I was like, oh, because you know, he and I would sit and he would talk, and he would tell me about his experiences, where he went, what he used to do, and you know, different things. Lots of things, great experiences. So I was looking forward to that conversation. So I'm still looking forward to it. I'm hoping that we can have that maybe in the next 24 to 48 hours. But no pressure.
Yeah, you rest up.
Step it up over there.
Oh, I can't wait.
He's like,
Can't wait.
Alright.
You know, how much is it to go?
how much?
How much is it?
To go where?
Oh, yeah. You are heaven.
Oh, to heaven? I mean,
It's free.
God knows.
God, no, you know.
Only God knows. But right now we're trying our best to keep you with us.
Yeah.
Yes.
Hi.
Hi, hi.
Good, how are you? You're looking good. A little loud. Thank you, Doc.
Well,
Thank you so much.
My pleasure. It was a pleasure to meet you all again. It's you know, I feel honored to take care of him. And if you have any questions or concerns, please let me know. On this phone call away, I apologize for the delay. Today I'm a hospital triage, so they text me about all admissions. So that's why, you know, I sometimes you have to wait. So my apologies for the wait. But thank you for
Thank you
waiting.
for everything.
Thank you for listening.
Thank you.
God bless.
Thank you very
God
much.
bless you. Yes.
It's
Absolutely.
nice to know he has TLC.
Yeah.
I
Absolutely.
appreciate that.
Absolutely, you know, that's everybody's gonna be here in this situation. You know, I'll be
Yeah.
someday I'll be in this situation. And I don't know what. God knows best.
Tired.
Alright. Take care.
Thank you so much.
Yeah.
Nice to meet you.
Thank you so much. Nice to meet you. Take care.